Mr.
We
Chairman,
have a very good healthcare system in this country.
Very good, perhaps. No. Very good, perhaps, sir. But it's not the best in the system, and I think it's not
Absolutely.
true when you tell people that.
I put this system up against any in the world.
Well,
period.
no, because you're talking about people who go and get care at any particular place in time. We're not talking about the system in terms of how it works monetarily. Monetarily, it's a disaster. In fact.
Well, yeah. I mean, there's a huge cost problem here that will become exacerbated by what this administration is about to do. Even CBO, says, well, the number's an estimate at $940 billion. And what does that tell you? In Washington speak, that means that is the floor of what this thing is going to cost. Can you just give me an honest number, Rick? How much do you really legitimately think adding, using the president's number, 30 million people to a healthcare system that you've just said doesn't work is going to cost the American taxpayer? How much do you think it's really good? $940 billion over 10 years. So you're telling me an additional $94 billion a year is going to make all of our problems go away?
According to the calculations that we did, and according to the calculations the Democrats are announcing today, it's going to save in the deficit for the United States citizens $1.2 trillion. Do you believe that's not true?
Okay, I got two words for you. I have three words. Three words.
Go.
That's a lie.
Okay.
It will not.
Well, you're arguing.
It will cost us. It will cost us trillions of dollars.
You're arguing with the CBO. You're arguing with the CBO.
Yeah, you know what? And let me tell you about the CBO.
Go ahead.
Right? Since they've been taken down to the woodshed at the White House last year, you can't believe the numbers. Why does it take the, CBO is only as good as what you put into it, as what you give it. So CBO is only, if you shave off some numbers, if you don't include certain things, if you don't put it the right way, their calculations are not going to reflect the real value or cost of the program.
But
let's be honest about that. So the number is only good is what Nancy Pelosi and Harry Reid and the president gives them, and they have given them bad numbers.
Is that fair to criticize the CBO now when during the Bush administration the CBO's numbers were represented and respected almost every time they came out with numbers by both sides? Now all of a sudden the CBO is not to be believed.
But President Bush never called the director of the CBO down to the White House to get the number out of him that he wanted. So President Bush never made the CBO the centerpiece of his legislation in order to get things passed. They put in the real numbers and came up with an honest assessment.
You're saying the President of the United States has corrupted the CBO with a personal phone call or visit? Well, I'm
just saying that, look, this whole process has not worked on behalf of the American people. And the reality of it is that when you look at the bottom line here, the taxpayers, the middle class, are going to have a heavier burden to pay once this thing passed, and Lord help us if it does.
But here's the hard truth.
Small business is the same thing.
But here's the hard truth. Here's the truth about this system that we keep saying is the greatest in the history of the world. Analysts and economists of nearly every ideological persuasion, left, right, in between, say the unrelenting rise in medical costs is likely to wreak havoc within this system and beyond it. And pretty much everyone is going to be affected, directly or indirectly. Doesn't that tell you that this system has to be reformed?
Yes, and no one's arguing that, Rick. No one's saying, Republican, Democrat, liberal, conservative are saying that the system doesn't need to be reformed. We get that. Where the battle lines have been drawn for the past year now is over how and to what degree you reform it. Republicans have argued from day one, let's do a bottom-up, doctor-patient-centered process in which, yes, we put insurance companies in check. We put lawyers, trial lawyers in check with frivolous lawsuits. We create portability opportunities for those who have pre-existing conditions and the like. We take care of small businesses by creating pools in the marketplace for them to go in collectively to have insurance companies compete for those insureds. There are ways to do that that doesn't mean upending 1/6 of our nation's economy.
Well, first of all,
the bottom...
Two things. Many of the things that you named have now been put into this system because of the meeting.
They've been watered down into the system.
Coburn and Price and some of these guys came up with wonderful ideas, right? And I think everyone agreed they were good ideas. Some have been included. But let us, for the sake of argument, say that we made the system based on just those changes. Two things. A, you wouldn't be able to give 30 million Americans who don't have health insurance the insurance that they need. And B, that wouldn't stop the downslide in the economy. You can't do it with Band-Aids, can you?
Now, we've done the analysis on this bill such as it's been put out. And under this bill that you're saying now, you're saying that what Republicans have said won't insure everybody. By 2019, 23 million Americans will still be uninsured in this bill.
Right.
23 million people. So effectively, we will only have insured, after spending trillions of dollars, 7 million more people. The reality of it is the approach the administration is taking here is just wrong.